Hi, I'm Don Huey. I'm a practicing internist and also the Medical Director of Quality Management at Facey Medical Group, and I was part of the CQC core group. What I understand you wanted to know was what we did as far as rolling out the program to our physicians. So after we had a 4-hour communication workshop, the group of physicians that received the training were then divided up between members of the CQC core group physicians, and then we would meet with those physicians individually, go over their patient satisfaction scores, go over some of the techniques that were available to them to improve those scores that they didn't achieve as well as they would like to. We would then sort of have them commit to a goal percentage of improvement, and during that time afterwards, we would meet with them periodically to see how the program was doing, how they were interacting with the patients with the new behavioral changes, any issues they had among their staff and themselves trying to implement the changes, gradually increasing the number of patients they would try these techniques on week to week, and then also going over periodic feedback that they would receive on a daily basis from surveys that would be given to the patients. And then later on we would have a formal telephonic survey. One physician, a busy ophthalmologist, very good clinically, busy practice, but he had a habit of having to go from room to room quickly and seeing the patients. So one of the techniques they said was to sort of slow down, introduce yourself to the patient, make sure you did that before you started the exam. And so one of the other techniques was just knocking on the door before you entered. So for him to remind him, he just had his nurse put a sticky pad on each exam room saying, knock. So that's what he would do. He would make sure he would knock, and then he would start the encounter off, I think, a little more slowly, and I think it actually improved his scores just by doing that technique. So it didn't have to be very high tech, but just it was for that type of.
How you doing? I'm Daniel Lewis, another practicing physician out in Canyon Country at Facey Medical Group. I was also lucky enough to be a part of the core group. We started at our board level. We all knew that this was an issue for years and years. Dr. Huey gave our medical group presentations about our patient satisfaction scores, so this was something that was out there, that our patient satisfaction scores were lacking. So we went to the boards. We told as an issue that our scores would have to be increased. We used the CQC as the vehicle. From there, we decided to get together during our CQC session in terms of what's the best ways to implement the program, and we came up with what we did.
Probably even prior to the rollout to all the physicians was the medical director at the time, Dr. Nelson, was really a champion in the board setting to get the resources needed to have the boards of both organizations agree to take the time out of physician schedules to do training, to increase the resources for our incentives for physician compensation, in regards to patient satisfaction. And I think also I have to give credit to both to the medical group board especially, because everybody took part in this communication training. So I think for the physicians actually in the offices, when they would go to one of the sessions and would see the medical director and the president of the group going through the same communication training that they were going through, you get the impression that this is really a priority for the organization. It was inclusive from everybody, from the newest physician we hired to our senior leadership. They would all take part. They all took part in the program. So I think that sends a message to the group as a whole.
Yeah. And also, I think being a part of the core group, there was a very collaborative feel between the physicians and the foundation staff. It wasn't separated out two groups. It was one group coming together, trying to increase our score.
I think what we did do, as Dan said, we made this sort of our burning platform, and we made it really, I think, a priority in the physician's mind for something that it needed to be done. And I think we did that. We accomplished that in a couple ways. One, we actually put a lot of resources from the organization with the approval of both the foundation board and the medical group board that this was an important initiative. So we would schedule time out of the physicians' days to come to the training sessions. We actually provided some financial incentives for them to do that also. We also made it the patient satisfaction scores themselves a higher percentage of our quality review at the end of the year for physician compensation. And then I think for the first time in a long time, we actually had a very structured program to give physicians tools to improve. So we didn't just keep telling them that you weren't doing well, do better. We actually gave them a tool set to use. We gave them feedback on a fairly frequent basis, as I've elaborated before.
You know, we had learned so much from the CQC. I've found myself saying, you know, quoting random facts about patient satisfaction during our small group discussions. It was great. So I thank the CQC for all these, all the effort and hard work and presentations that you guys put together. It really was a quality program. To have this knowledge and to try to impart it to our physicians was, I think, our biggest role. And like Dr. Huey said, there's a lot of initiatives at Facey. There's that likelihood of program burnout, but clearly the physicians thought that we were passionate about patient satisfaction. We were passionate about moving this, and we gave them tool sets and a vehicle to learn how to do this. So I think that was our biggest role, to try to interface between all the didactic teachings that we heard and bring it to the physicians, and it was fun.